Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. The GLP-1 drugs that so many people are seeking for help in losing weight got their start in the 1980s when they were identified as insulin-stimulating hormones. So I'm turning to an endocrinologist with experience prescribing these drugs to his patients with diabetes. Dr. Malek El Muayed is an associate professor of medicine and acting director for Upstate's Joslin Diabetes Center. Welcome to The Informed Patient, Dr. El Muayed.
Thank you for having me.
GLP-1 stands for glucagon-like peptide. Can you tell us what that means?
The name harkens back to the original discovery of GLP-1. These mimic internal hormones called GLP-1, and some of the related drugs also stimulate a related hormone called GIP. What they do is primarily get secreted when we eat from the gut, and they prime the cells in the pancreas, the islets that make the insulin, to make an appropriate amount of insulin when blood sugar arrives in our bloodstream. So they enhance the secretion of insulin. That's one way how they treat diabetes. They also slow the digestion and slow the gut down, which is just a reaction that helps the gut naturally digest our food better. That's their usual function in our body. And at some point, people discovered that we can make molecules that mimic that hormone and achieve the same action. And by giving ourselves a higher dose of these molecules, we essentially supercharge these effects, namely enhancing the secretion of insulin when it's appropriate, but also slowing digestion down, which makes us feel fuller longer and helps us digest the food appropriately and in a controlled manner. Later on, we also discovered that these medications likely have a direct effect on the brain that induces satiety, which again, all these are normal reactions that we should have when we eat. That's why the body naturally secretes GLP-1 and GIP. But again, by developing drugs that overstimulate that pathway at these different levels, we can achieve quite a few desirable effects, namely treating diabetes, but also, as we later found out, managing weight quite effectively.
How many people who have diabetes are taking GLP-1s? Is this a pretty common medication for them to be taking?
It is now a very common medication for treating diabetes. The way it treats diabetes is essentially it attacks it from two different angles. As you know, diabetes, specifically type 2 diabetes, arises when we put on more weight over time, and with passing time, we react less readily to insulin. Insulin is the only hormone in our body that lowers our blood sugar level or keeps our blood sugar in normal ranges. And as we age, we develop this insulin resistance. So in order to achieve that blood sugar regulating effect of insulin, we need more of it, especially if we put on weight, live sedentary lifestyles. And the pancreas, under most circumstances, can adapt to a certain degree and secrete more insulin, but over time that can fail. And if that fails to a certain degree where we just cannot meet this increased demand anymore, we develop type 2 diabetes. And these medications attack type 2 diabetes from two different angles by directly enhancing the secretion of insulin from the islets in the pancreas, but also at the same time by reducing weight, slowing down digestion, and reducing appetite, which leads to weight loss. And that weight loss in itself will reduce the amount of insulin that we need to regulate our blood sugar. So by reducing weight and at the same time stimulating secretion of insulin, these medications attack diabetes and treat diabetes from two different angles.
How did the GLP-1s emerge as a medication that could help people lose weight separate from diabetes?
When we started using the early versions of this class of medications, early versions needed to be injected twice a day. They weren't very powerful. They worked only for a few hours, so you need to inject them before your biggest meal, twice or three times a day. We found that people that take these medications start losing some weight, although the effect was modest. Over time, we developed more powerful and longer-acting forms. Most forms that we use these days are injected once a week and are much more powerful than the initial drugs. And we found that people who started using these medications lost quite a bit of weight. It can vary from person to person, but some people really lose quite a few pounds on this. And it's probably one of the most powerful medications for weight loss compared to other medications that were tried over the years. So it was essentially initially an observation that we observed in people with overweight and type 2 diabetes who are taking these medications. And over time, many of these medications were approved for weight loss by itself, even in people who don't have diabetes.
Is it safe for people who don't have diabetes to take these, and is there an impact on their insulin production?
All medications have side effects, so there's always risks and side effects that could potentially arise. So this is something that you definitely should discuss with your physician. But overall, the side effects are similar in people who take it for type 2 diabetes or if you take it for other indications such as weight loss. The main side effect is GI side effects. It works on the gut. It slows digestion down. The extreme form of that is nausea. So many people, up to 70%, have some form of GI side effects, mainly nausea. In some people, it can even lead to emesis or vomiting. Diarrhea, constipation, these can also arise, but also more serious side effects in the GI tract, such as inflammation of the gallbladder, inflammation of the pancreas, although the link doesn't seem to be as strong as initially thought, but there is potential for more serious effects on that respect in some people. The other major side effect that we need to probably discuss, namely weakness and dizziness. Some people experience that mostly in the early days after the injections, but also there's other risks that one needs to discuss with their physician. There's some indication that it increases the risk for a rare form of thyroid cancer called medullary thyroid cancer. So if this rare form of thyroid cancer, medullary thyroid cancer, runs in the family, you should not take this medication. Also, a closely related genetic abnormality called MEN2. People who have that known genetic abnormality should not take this. Although the good news is most of these families know about them having this genetic mutation and will probably be not eligible for this medication because they already know about that. Other things that are important to discuss is if you have gastroparesis. So this is essentially various degrees of paralysis of the stomach where it can't empty normally. This can sometimes be a complication of diabetes itself. People who have gastroparesis should have a good discussion with their physician whether they are eligible for that, because these medications oftentimes worsen gastroparesis. Usually this is temporary, but in some people there's reports of this worsening permanently, which can be a very undesired side effect. GI side effects that should probably be taken into account is reflux, so heartburn, where the acid from your stomach goes back into your food pipe and causes burning there. That can injure the food pipe in extreme forms and can lead also to changes in the tissue in the food pipe, in the esophagus. People who have any of that should, again, have a good discussion with their physician whether they should be taking these medications or not, because, again, by slowing digestion, these medications can worsen these conditions. And lastly, one important aspect too is these medications, as discussed earlier and as everyone knows now, reduce weight. And by reducing weight, you lose fat mass, but many people also lose muscle mass. So these medications can lead to reduced muscle mass and muscle weakness. Extreme forms of that can be that people cannot walk anymore and need to be in a wheelchair. So people really need to make sure that they exercise their muscle, keep moving, keep walking, which is a general recommendation for everyone. Moving is always good. Moving is an important part of healthcare. So making sure that this gets mitigated by moving your muscles, keeping your muscles active. Also, good nutrition, balanced nutrition with adequate amounts of protein is very important.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with endocrinologist Dr. Malek El Muayed about the GLP-1 drugs that so many people are taking for weight loss these days. Why have they been injectable? And I know oral versions of some of these pills are coming out soon. Will they be as effective as the injectable have been?
The original drugs are essentially derivatives of the hormones that we secrete from our gut, the GLP-1 and GIP. And these are so-called peptides. So these are molecules that consist of amino acids. This is essentially the base building blocks for proteins. These usually get digested when we take them by mouth. That said, there is one version of, for instance, Ozempic or Wegovy that is also taken as a pill. It's been available for quite a few years. And the way they achieve that is by just putting a very high amount of that peptide in that pill and also protecting that molecule via various means from digestion. But it is not used widely. Some of the problem with that medication is that the GI side effects tend to be a little more pronounced, and at least that's my experience with my patients. But now that more pharmaceutical companies are trying to develop improved versions, they developed so-called small molecules that can be ingested by a pill and can be taken up by the GI tract. We'll have to see how effective they are, but the initial results are very promising. Also, the side effect profile, we will just have to see how that pans out once these medications are more widely used. Again, the concern is it goes to the GI tract where most of the side effects happen. So there's some concern that the GI side effects might be a little more pronounced, but again, time will tell if this pans out. And these medications that are planned to be administered by pill are manufactured in certain ways where the side effects get mitigated by, for instance, only activating them later on when they're in the bloodstream as opposed to activating them in the GI tract.
Can you talk about how the GLP-1s reduce cardiovascular risk?
Some of the indications now have been expanded where it is encouraged to use these medications as a first-line agent in people with type 2 diabetes and cardiovascular disease, both to treat the diabetes, but also to reduce the cardiovascular risk, because we observed in several studies that these medications have a quite pronounced effect in reducing risks for recurrence of cardiovascular effects, such as heart attacks and strokes. How that happens is a matter of debate. Some researchers have found that GLP-1 receptors, so the places where these molecules act, are present in some components of the cardiovascular system, namely the vessels and the heart. So there's some theory that it is a direct effect on the heart and muscle, but there's actually very good evidence that some of that effect at least is due to the weight-losing effect. High weight is by itself something that induces a cascade of events in the body that increase the risk for cardiovascular disease. And by reducing weight, this is likely to reverse many of these secondary effects of high weight. And thereby, by reducing the weight, at least it seems to be one of the mechanisms by which these medications reduce cardiovascular risk. Closely related to that, there is also some evidence that some of these medications reduce the risk for progression of kidney failure. So some people who have diabetes and also at the same time have some degree of early kidney failure, there's some evidence that these medications reduce the risk for progression of this kidney failure, or at least slowing it down. Then again, it is hotly debated how that effect comes about, but there's good chance that this is an indirect effect of improving diabetes itself, because diabetes worsens kidney functions, but also through losing weight. So both for the cardiovascular effect, but also for the kidney effect, it is likely mostly an effect of reducing the severity of diabetes and treating diabetes and help managing diabetes, but also reducing the weight, which both seems to be contributing to the cardiovascular risk, progression of kidney disease. But there is some evidence that it may also be a direct effect of these drugs on the vasculature, so the vessels, potentially also on the kidney and the heart.
I appreciate that you went over the side effects because there seem to be quite a few of them. But let me ask you, for someone who is about to start a GLP-1 drug for the first time, do you have any advice in terms of diet and anything else that the person should do if they're starting a new medication?
These medications promote satiety, and the extreme form of satiety is nausea. So nausea, again, is a very common side effect. Up to 70% of people who start taking these medications experience some GI side effects. And the main recommendation that I usually give to my patients is to eat smaller meals, eat less fatty meals, because big meals and fatty meals are really the ones that really supercharge this side effect of nausea, sometimes even vomiting. The same thing goes to some extent for diarrhea and or constipation, which is somewhat contradictory, but some people experience one, some may experience the other, some may experience none. It is important to stay hydrated, because if you reduce your food intake, some people also will reduce their fluid intake. That's number one. Number two, some people may experience diarrhea and you can lose liquids through that. So it's important to make sure you stay hydrated while you're on these medications. And again, while we're talking about side effects and potential side effects, although the link may not be as strong as initially thought, there may be a link to inflammation of the pancreas, so pancreatitis, as well as gallbladder complications, such as inflammation of the gallbladder, especially in people who have pre-existing gallstones. These can sometimes get dislodged when you take these medications and either cause an inflammation of the gallbladder or the pancreas. These are more serious complications. So if someone experiences severe belly pain, abdominal pain, they should seek medical attention right away. Also, an important side effect to note is recently there was some reports of people with vision loss. It seems to be very, very rare, but it is something that if you experience, you need to seek medical attention right away and stop the medication right away. Vision loss can happen through two different mechanisms. One recently reported is a direct inflammation of the optic nerve. That seems to be very, very rare, but it's still something that one needs to be aware of. The other thing is if someone has pre-existing complications in the eye from diabetes. This is called retinopathy. So when the vessels in the background of the eye are affected by diabetes, that can be something that can lead to blindness. That's why we recommend people with diabetes, any form of diabetes, see their eye doctor at least once a year. And if they recommend you be seen more often, you get seen more often. It is important to keep that up. And the main reason for that is oftentimes these GLP-1 agonists can lead to a quite marked and fast improvement in diabetes control. And during this transition from poor diabetes control to good diabetes control, that phase, that rapid improvement in diabetes can sometimes bring out things that were brewing in the background of our eyes. Retinopathy can paradoxically, in the short term, manifest itself while you're improving your diabetes control. That's true for GLP-1/GLP-1 agonists, but also many other treatments for diabetes that improves the glucose control, the diabetes control in a short period of time. So it's important to make sure you keep up with your visits with the eye doctor to make sure there's nothing happening there. And obviously, if there's any changes in vision, make sure you seek medical attention right away because that can be vision saving. To be clear, in the long run, improving diabetes control is the only and the best thing you can do to protect your vision. This should not be something where people would be cautious about improving their diabetes in order to preserve their vision, because the only thing that actually preserves their vision in the long run is improving diabetes. It's just this transition period between poor glycemic control, poor diabetes control, to good diabetes control that is sometimes a little of a danger zone, where things may have been brewing for a year or two and then come out suddenly. So important to keep in mind.
Do you think that most people who are going to take these GLP-1s understand that this is a lifelong commitment? Because I've read the weight can come back if you stop taking it, right?
Very good question. So we have to be clear that the effect goes away the moment you stop taking this medication for the diabetes, but also for the weight. So oftentimes you may need to make sure you keep checking your blood sugar. A high portion of people who stop these medications will gain some, oftentimes most of the weight back, and some even go beyond where they were initially. So we do try to stop these medications in people, but really, really emphasize lifestyle modifications, trying to preserve the changes in dietary habits, which seem to be the main driver for the weight loss that's associated with these medications, to maintain that and be very vigilant about falling back into old habits. It is easy to say that, not easy to do. It has to be recognized, and one has to be clear that some people will just not be able to maintain the weight loss, or at least not all of the weight loss that they achieved on these medications. So this is something that we have to be very cognizant about. And some people will remain on these medications long term. Maybe we can reduce the dose, but some people cannot maintain the weight loss. But it is something that we can try and should try, because we should minimize giving medications if we can do without.
Well, you've given us a lot of good information about this. I appreciate your time, Dr. El Muayed.
Thank you.
My guest has been Dr. Malek El Muayed, an associate professor of medicine at Upstate who specializes in endocrinology. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.